We are answering your questions about the coronavirus with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. This person is asking, I have a bad reaction to bee stings and I have to keep shots to keep my throat from swelling up. I've been told not to take the vaccine because of the risk. What is your opinion?
Now, we've had several people with bee sting allergies that have anaphylaxis, that swelling of the lips, as well as food allergies like peanut allergies, who've tolerated the vaccine. We just recommend that you come on in and let them know. Also bring your EpiPen with you, and the observation time gets extended to 30 minutes to making sure you're okay. But most vaccine sites will know how to handle it if you have any reactions, but I believe it should be safe.
All right, this person is asking, how come the rapid test is offered if it's unreliable?
Oh, those are such strong claims. I would say that, there is definitely some benefits to the rapid test. These are those antigen tests and quick nasal swab, and the answers come back in 15 minutes, right? And they have value, especially early part of the disease, but it really depends on the clinical history and the time of exposure. So if somebody's still symptomatic and they have a negative test, I would definitely do the PCR test. But you may know the answer pretty quickly if you have the right symptoms, if you have COVID-like symptoms, and I still would trust it.
So this person is asking, if you're fully vaccinated, do you have to wear a mask when visiting someone at the hospital?
That's a fantastic question, because I think, when Governor Cooper relaxed the masking rules in our community, the one place where it does not extend to is the hospital setting. So all hospitals will still require visitors to wear masks, even if you're fully vaccinated. It's just we have so many patients and maybe other visitors that are nearby that are not vaccinated. And it's super important just to keep everybody safe. So masking within the healthcare system is still a standard, probably across the board. I don't think I know of any healthcare institution that's changed those rules quite yet.
Mm-hmm. This person is asking, if I got the J&J vaccine and it's not as effective as others, and maybe it wears off, can I get another kind of vaccine in 6 months?
I think that's a fantastic question. I think a lot of people are saying, I'd like to try a different one so I get protection from different spike proteins. And I think we just don't know quite yet what the answer will be. I know that there are studies, well, at least looking at people who've received different vaccines and what's the impact with their immune response. I think over the next few months, especially as fall comes around, we'll probably have some answers to those questions.
All right, this question is it safe for someone with SVT to take the vaccine?
Yeah, so SVT is known as supraventricular tachycardia. It's a type of fast heart rhythm that can be triggered by a gamut of different stuff like exercise and yeah, it's safe for somebody to go ahead and get their vaccine.
All right, and this question is, if you test positive for antibodies, does that mean that you are protected from COVID-19?
So we don't know. Yes, depending on which antibody test you get, it may tell you that you're immune by vaccine status, or you're maybe immune by having the natural disease. And we don't know if at what point what the level of immunity you need to protect you against reinfection or getting the disease. So I don't think the simple blood test would tell you that. It tells you that you have antibodies, which is great, but we don't know the range for which we don't necessarily recommend folks to test to find out that they have immune from the vaccine status. It's just we know that it provides a lot of immunity.
Gotcha. Okay. Thank you so much for your time and your expertise. Thank you for asking your questions. If you missed anything, it will all be in the Two Wants to Know section.